Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, March 22nd, 2020. COVID-19 update. A lot to talk about tonight, not in super detail, but just observations. First and foremost, President Trump gave a talk today, a news conference, press conference. I thought they said basically nothing except business stuff, which was a little disappointing. The number one focus should be on preventing spread of COVID and limiting deaths. He did point out that the chain of development or producing things was great, and I completely agree that what he said, asking people to get involved or companies and then them calling the federal government saying, hey, we can make ventilators or we can do this is a lot better than the government telling someone who doesn't know how to do anything to do it. The thing I was concerned about though was we need to close down the country. It's not just me, it's many other people, but I do want to definitely say I was incorrect. I can't believe we're not shutting the country down now, but we're not, and so I thought it would be between 25 and 50, which may happen, 50,000 people, but I actually, with the data that was coming out, it was obvious to me that it needed to be between 15 and 25. And again, it's not just me, it's thousands and thousands of physicians and virologists and people who model this stuff who are a lot smarter than I am, but just synergizing the data, looking at everything, the patterns, it's obvious to me we needed to do that, but we're not going to. When we look at our state, Oklahoma, we have 67 cases and 2 deaths now. The governor had a news conference today with the secretary of the health department for our state, a physician who's in charge of something, and then General Thompson, who's in charge of the National Guard. The most important thing I saw today was that General Thompson is absolutely as amazing a human being as we could ever have running our National Guard. The point he made, which all of us have to understand, because we're in Oklahoma, and people who may hear this, who are in more conservative states where people believe that their individual rights trump everything else, in some respects, is that General Thompson said the National Guard is here to help. They're not going to establish martial law. They're going to take care of us. They're our friends, they're our neighbors. One of my nurse practitioners' husband is in the National Guard here in Oklahoma. Now he's in the band and he's a fabulous jazz drummer. So I don't think we may see him doing a lot of things in this situation, but again, it illustrates they're our friends. I mean, the National Guard is our friends. We don't have to worry about them. So be kind to them if they end up helping out. They're not there to cause obstruction. They're there to save us. And we're going to need some saving, I have a feeling. So let's be nice to our National Guard. The State Health Department Secretary was also very good. Governor Stitt and the physician who's in charge of OSU, she's the president, talked about increasing our testing. I think increasing our testing is a fabulous idea. Here I am, I had my test on Tuesday, it's Sunday. I'm not going to get my results now till probably Tuesday, Wednesday, or Thursday. I could be dead by now for all the good it's done me to get the test, but you know, hey, one of my cohort physicians who was exposed went to Baptist. He had the test. They called him today and said, oh, we didn't actually run the test because we ran some other tests and blah, blah, blah. One way or another, it didn't get done. And that can just happen because there's a lot of pressure on these lab people to get the test done. And the problem with that is lab people aren't used to having that much pressure to get tests done. So this whole concept that OU and OSU is suddenly going to be able to pop out 10,000 tests in a week isn't going to be true. They're going to have to build up, do quality control testing, and hopefully eventually they'll get to 10,000 tests a week. But it's going to be, or maybe even 10,000 tests a day, but I think that's going to take several weeks. So I'm glad that they're working on getting testing done, but it's going to be a little longer than they said in the news conference because they're always going to emphasize the positives and not necessarily be as clear as they should be. Likewise, I think one of the things we need to think about a little bit is just the COVID virus itself. So let's talk about this little puppy right here. I'm bringing out my viral ball, which I'll bring out every now and then. I haven't brought it out for several weeks. So imagine this is COVID virus. The number one thing is these things that stick out. It's proteins. The COVID-19 virus has a protein that's much more sticky. It's a little longer than normal, so when it touches you, it sticks. It's really annoying because that's what makes it so infectious. It's 1,000 times more infectious than SARS was. It's massively more infective than the flu, so that's a problem. The second problem is when you cough, if you have it, or just even breathe, it can go 2 to 3 meters out from you. That's the scientific data. It doesn't stay close. And so how long will it stay infectious in the air? It's at least 3 hours. So that's another problem. The other thing is when it lands on you, right here, it lands on your hair, right here, it could last for a while, or on another surface, it could last hours and hours or days, up to 3 days on some surfaces. So that's the problem with this virus. It's super infectious. And then once you get the infection from the virus, it takes 3 days before you start secreting the viral particles, and then somewhere in those next 14 days you may get symptomatic. A vast majority of people may not. That's the current thinking, but a substantial minority will. And if you look at the Oklahoma data, more than 50% of the people, or the majority of people, are between 49 and 18, which is a sign that we're not testing enough. It's not a sign that we're predominantly young people. It's a sign that we're not testing enough here because we have no tests. So that's one of the things you also have to keep in mind about this. So that's a little bit more negative than I want it to be. Let's talk about positives. So one of my friends called me or texted through the internet to me that she had a connection with Harbor Freight, and Harbor Freight is a large company. They have a lot of personal protective equipment for various reasons, and like a huge amount, and they had notified people in their community, and she was one, that they want to get that out to tertiary care medical centers, so she wanted me to know. So I got the email from her on that contact and sent it to the Baptist Integris people, Mercy, OU, and Saints here in Oklahoma City, and that's just wonderful. And that's the thing that makes Oklahoma special, which is what Governor Stitt talked about. We have great people here, and there's tons of people who've emailed me and texted me and Facebooked me on how can I help and what can I do. I have another patient and friend who wants to know what the best material is, so I'm working on that for masks, because she has a connection with a manufacturer that any material for masks they'll make for, or they'll supply for her or a large group so they can make masks, but they want to know what's the best material. I don't know that off the top of my head, so I'm working on that right now with an infectious disease doctor. So that's the thing about Oklahomans. They're giving everything they can, just like Governor Stitt said in Guthrie, one of the distilleries, Prairie Gypsies, maybe, I can't remember what it was, Prairie something. Oh, my wife gave me the nod. I said it wrong. Whatever it was Prairie something. And Guthrie is converted their distillery to a sanitizer factory. So they're making tons and tons of sanitizer. And as Governor Stitt said, they've already made almost enough for everybody to get an 8-ounce bottle of hand sanitizer like Perel. So, I mean, this is what Oklahomans do, but I also want to point out to people in other states, that's what everyone's doing all over the country, and God love you all for doing that. So when we think about what's going to go on this next week, I would encourage all of you to socially distance. I would stay at home. I would not go to work unless you have an essential job. We went to the Firestone, not we, but my wife went to the Firestone this weekend because we had a nail in our tire. Those people are stressed. I mean, they're worried about the virus. Everyone working is worried about getting the virus. And so be nice to everyone. That would be my one request. I am nice usually to everyone. Now and then my wife will laugh at me when I say that. But I try to be nice. And I think it's very essential that we all are respectful and kind to everyone working and everyone we run into, because all the people in the United States feel the pressure that could this person they're seeing right now be a carrier of COVID and be giving them it. And since we don't have enough masks and we don't have the things we need, people are at risk for infection. Now, I will take exception with Dr. Oz, who usually is on target with things, saying that it's not patriotic to wear a mask. That's a bunch of baloney. If you can wear a mask, wear a mask. I'd wear a mask. Plus, don't judge people wearing a mask. Let's say someone has cancer. Let's say someone's immunocompromised. They could have a variety of diseases that require, in this situation, they should wear a mask. Anyone with asthma or lung disease or heart disease, if you go out without a mask, you are not being very smart. So while there's not a lot of masks now, I believe there'll be a lot more masks in the coming months. And if you can get one, wear one. Why wouldn't you? We just have to supply the hospital people first this next month or two, and then there'll be enough for all of us. So that would be a final thought, besides just being nice. So I will update you all tomorrow, depending on what the news is. I would certainly encourage anyone watching this to email, text any representatives that we need to shut down our state. That's a difference of opinion from the Governor Stitt, but hey, I'm a doctor who was at the U.S. Public Health Service, and I think the states who've done that are going to do much better than the states that don't. Our numbers are low for one reason. We have no testing, or if you get a test, you can't get the results like me. So that doesn't really help. I still think we've done well less than 600 or 700 tests in the entire state. So it's nearly impossible to have a realistic number or idea of what the disease event is. So it's better in public health to be conservative than a radical and say not to do stuff, but that's my opinion as a physician. So anyway, take care, good night, be safe.